Imagine you've been doing everything right. You have a health savings account, an HSA, and you've been contributing to it for years, building up a tax-free cushion for medical expenses in retirement. You're 65, still working, still covered by your employer's high-deductible health plan. And then, for one reason or another, you sign up for Medicare. What nobody warned you is this. The moment you enroll in any part of Medicare, you are legally prohibited from making another dollar of HSA contribution. Not next month. Not next year. Not ever. As long as Medicare covers you. And if you don't catch it in time, the IRS will charge you a penalty on every dollar you contributed after that date, and keep charging it every year you leave the excess in the account. This video is about that trap, what triggers it, why it catches people who are doing everything else right, and exactly what you need to do to avoid it, or to correct it if you're already in it. Let me be clear about who this is for. You're probably in one of three situations. You're approaching 65, still employed, contributing to an HSA, and trying to figure out whether to sign up for Medicare now or delay. Or you're already past 65, you've been delaying Medicare because your employer coverage is solid, and you've been contributing to your HSA without realizing there may be a problem. Or, and this surprises more people than any other scenario, you've recently claimed Social Security benefits, and you're about to discover that claim automatically triggered a Medicare enrollment you hadn't planned for. If any of that sounds familiar, the next 10 minutes could save you a significant and completely avoidable tax penalty. Let's start with what the official rules actually say. IRS Publication 969, that's the IRS's dedicated guide for health savings accounts and other tax-favored health plans, is explicit on this point. The publication includes a section titled specifically Enrolled in Medicare under the rules governing HSA contributions. The rule is direct. Once you are enrolled in Medicare, you lose eligibility to contribute to an HSA. Any contribution made after your Medicare start date is, in IRS language, an excess contribution. And excess contributions, per Publication 969, are subject to a 6% excise tax. Every single year they remain in the account and are not corrected. That 6% is not a one-time penalty. It compounds. If you make a contribution in error this year and leave it in your account for 3 years, you owe the 6% penalty 3 years running. Now here is the piece that Medicare.gov makes very clear, and that most people approaching retirement don't fully understand: the backdating rule for Part A. According to Medicare.gov's guidance on when coverage starts, if you sign up for Medicare Part A after turning 65, your coverage does not simply begin on the day you enroll. It starts 6 months earlier. Here is the exact language from Medicare.gov. Your Part A coverage starts 6 months back from when you sign up or when you apply for benefits from Social Security. Coverage can't start earlier than the month you turn 65. 6 months back. That means if you sign up for Medicare Part A in October, the government treats your coverage as having been active since April. If you made HSA contributions from April through September, while you were, in your own understanding, still on your employer plan and not yet on Medicare, every dollar of those contributions is now retroactively classified as an excess contribution. You made them in good faith. You weren't enrolled in Medicare when you wrote the check. But Medicare's retroactive clock does not account for your intentions. The IRS does not account for your intentions. You owe the penalty. And there is a second trigger, one that catches even more people off guard. When you apply for Social Security retirement benefits, your Medicare Part A enrollment is established based on that application date, with the same 6-month look-back that Medicare.gov describes. So if you've been delaying Social Security and finally claim it at 67, you may find that Medicare Part A is retroactively active going back 6 months from the date of your application. Any HSA contributions you made during those 6 months? Excess contributions. Penalty. This is the center of the trap. 2 federal systems, the IRS and Medicare, operating under rules that interact with each other in a way that neither agency is required to proactively warn you about. So why do so many people miss it? The conventional wisdom sounds like this. You can keep contributing to your HSA as long as you don't officially sign up for Medicare. That's partially true, but it's dangerously incomplete in two ways. First, it ignores the backdating. You can delay your enrollment date, but when you do finally enroll, 6 months of your past contributions can be pulled backward into the penalty zone. The delay only postpones the collision. It doesn't eliminate it. Second, it ignores Social Security's relationship with Medicare. Many people assume they have to actively choose to sign up for Medicare. But if you are already receiving Social Security retirement benefits when you turn 65, Medicare.gov indicates your Part A coverage starts automatically the month you turn 65. If you claim Social Security at 62, 63, or 64, Medicare Part A arrives on its own schedule. Social Security does not ask whether you have an active HSA. It does not pause to check whether stopping contributions at that exact moment is convenient. The enrollment is automatic, and so is your loss of HSA contribution eligibility. Here is a decision framework you can use to figure out where you actually stand. Case 1. You are under 65, still working, still contributing to an HSA. You are safe for now, but begin planning. Know your initial enrollment period. According to Medicare.gov, that is a 7-month window, the 3 months before the month you turn 65, the month itself, and the 3 months after. Use this window deliberately. Decide before it opens whether you will enroll at 65 or delay, and treat that decision as inseparable from your HSA contribution plan. Case 2. You are 65 or older, still working, and want to keep contributing to your HSA. Delaying Medicare Part A may be an option if you are covered by an employer group health plan, but verify this with your employer's HR or benefits department, because the rules depend on your employer's specific plan structure. If you do plan to delay, build a hard stop into your calendar. Stop making HSA contributions at least 6 months before you plan to enroll or apply for Social Security. That 6-month margin is the exact window Medicare backdates. It is not a cushion. It is the minimum. Case 3. You are planning to claim Social Security benefits after 65. Treat your Social Security application date as your Medicare trigger date. Per Medicare.gov, Part A coverage starts 6 months back from when you apply for benefits. Stop contributing to your HSA 6 months before you file. Not the month before. 6 months before. Case 4. You have already made contributions this year, and you are now worried you may have a problem. Do not ignore it and hope it resolves itself. It will not. IRS Publication 969 covers the corrective withdrawal process. If you withdraw the excess contributions, plus any earnings attributable to those contributions, before your tax return deadline for that year, including any extensions you file, you can avoid the ongoing 6% excise tax. Contact your HSA administrator and ask specifically about a corrective distribution. The sooner you act, the lower the cost. Let me make this concrete with a real example. Take Robert. Robert is 66, still working full-time, covered by his company's high-deductible health plan. He has been contributing the maximum to his HSA. According to IRS Publication 969, the 2025 HSA contribution limit for self-only coverage is $4,300, and Publication 969 allows an additional $1,000 catch-up contribution for people 55 and older, bringing Robert's annual maximum to $5,300. Robert contributes steadily throughout the year, about $442 per month. In October 2025, he signs up for Medicare. His employer plan is changing, and the timing feels right. What Robert doesn't realize until he's sitting with his tax preparer in February is what Medicare.gov's backdating rule means for him. His Part A coverage is set to April 2025, 6 months before he signed up. That means every contribution he made from April through September of 2025, 6 months at $442, is an excess contribution. That is roughly $2,650 in contributions the IRS now treats as excess. Under Publication 969's 6% excise tax, Robert owes approximately $159 for 2025. If he leaves the money in the account, he owes another $159 for 2026, and so on. But if Robert's tax preparer catches this before the April 15th deadline, or October 15th if he files an extension, and Robert contacts his HSA administrator to take a corrective distribution of the $2,650 plus earnings, he can resolve this cleanly. He'll still owe tax on the withdrawn earnings, but the recurring annual penalty stops. The window to correct matters. Leaving excess contributions in place does not make the problem smaller. It makes it larger every single year. Here's what to do next. First, go to irs.gov and pull up Publication 969. Search the document for the section titled Enrolled in Medicare. It is the IRS's primary guidance on exactly this situation, and it covers both the prohibition on contributions and the corrective distribution rules in plain language. Second, go to medicare.gov and read the page titled, When Does Medicare Coverage Start? That page explains the 6-month backdating rule directly, and it includes a specific call-out for people who have a health savings account. Bookmark it. Share it with anyone you know who is still contributing to an HSA and approaching 65. Third, if you are 64 or older and still contributing to an HSA, determine your likely Medicare enrollment date and count back exactly 6 months. Write that date down. That is the last month in which you can safely contribute. Inform your payroll department. Do not assume the system will flag it. It will not. This is educational content, not financial or legal advice. For decisions specific to your situation, verify the current rules at irs.gov, medicare.gov, or ssa.gov, or speak with a licensed tax advisor or benefits counselor who is familiar with HSA and Medicare coordination. This is a narrow enough area that it is worth finding someone who knows it well. The single most important thing to carry away from this video: the IRS and Medicare are two separate systems, operating under rules that interact with each other in ways that neither agency is required to proactively reconcile for you. Medicare's 6-month backdating rule and the IRS's HSA contribution eligibility rules collide silently, and the penalty that follows is entirely real and entirely avoidable, but only if you know to look for it before it happens. If you have already navigated this decision, whether you planned ahead and stopped contributions in time, or whether you found out about this rule in a less pleasant way, tell me in the comments. Your experience is genuinely useful to other people who are working through this right now. If this channel is new to you, subscribe for more plain language explanations of the retirement rules that actually affect your money, sourced, specific, and without the hype. We will be here,